BuyBeauty, make you pretty.
A women's killer, breast cancer. Love yourself and check them routinely. Do you examine your breast by yourself routinely? Have you ever found any unusual, unclear lumps? Has anyone in your family had breast cancer? Did you know that the chance to get breast cancer is 120 times greater than the chance of being in a plane crash? Did you have any idea that you have to remove your breasts as long as you have breast cancer? The most dreadful killer for women in this century is breast cancer, above AIDS and cervical cancer. Breast cancer has been the #1 cancer to cause death. Anyone who has breasts might have breast cancer. According to the statistics released from the Health Bureau, there is 1 new breast cancer patient every 12 minutes. The death percentage for a patient who is in the final phase of breast cancer is almost 100%. The mother of Bill Clinton, who is the former president of the United States, died of breast cancer. According to doctors, there is 1 breast cancer patient in every 8 people. It is the #1 cancer killer among European women. In the year 1999, there were an estimated 176,300 new breast cancer patients in the USA, and 43,700 of them died eventually. It doesn't mean you won't have breast cancer, you just may not have found it yet. Many well-known Asian television stations reported that many women all around the world have benefited from the medical bus check. A famous television program did an interview with a notable doctor, Dr. Xie, who has a high appreciation for the medical bus check after using it. Do you have any idea about the chance of getting breast cancer? The statistics from the Health Bureau tell you all about it. The top high-risk group, the chance of having breast cancer is 4 times greater than other people. People who have breast cancer in one breast, women with an unusual family disease history, or families who have 2 sides of breast cancer before menopause, those whose breast slice shows the unusual cell increasing, women who have had implant surgery. Medium high-risk group, the chance of having breast cancer is 2 to 4 times greater than other people. People whose mother or sister has had breast cancer, those who have given birth after the age of 30, women who have never given birth, people who gain a lot of weight after menopause, ovary cancer and womb cancer patients, women who have experienced tremendous radiation exposure to the breasts. Sub-high-risk group, the chance of having breast cancer is 1.1 to 1.9 times greater than the other people. People who drink regularly, women who had their first menstruation before the age of 12, those who have experienced menopause after the age of 55. Other high-risk group, women on the birth control pill, those taking climactic hormone supplements. Dr. Xie's impression of the medical bus check is as follows. This product has its own special meanings. It increases the touch area while women examine their breasts. It provides another examination for women to follow. It can avoid sex harassment while doctors do breast examinations for patients. The factors that cause breast cancer are still a myth. Females who have implant surgery should pay more attention because implant surgery is one of the factors that causes breast cancer. The only way to prevent from having breast cancer is to examine your breasts by yourself and see if there are any unusual lumps. The earlier you find out, the greater chance you have to cure it. Normally, women should examine their breasts 3 to 5 days after having their periods. But it is difficult to do a self-examination because there are 5 phases of breast cancer. The breast lump is 10 times smaller than a sugar grain in phase 0, so it is too tiny to touch. The finger's sense of touch cannot detect the lump because it is too small and slippery. In fact, it is hardly even detectable by X-ray. Many breast cancer patients can hardly tell the difference between a tumor and a normal breast lump. How do they feel respectively? Unfortunately, it has reached phase 2 or 3 by the time you find out there is an unusual tumor in your breast. At that time, you need to have surgery to remove your breast to eliminate the cancerous cell. It is unacceptable for most people to remove their breasts. There will be an ugly scar on your breast. You need to do a self-examination daily by using the medical bus check in order to prevent from having this disease. It has the ability to enlarge the sense of touch and to prevent lumps from moving around as a result of pressure. It also helps women to discover the tumor since it is smaller than a sugar grain at the very beginning. After finding a lump, go to see a doctor immediately. It is very easy for everyone to use the Medical Bus Check breast lump detection bag. Women need to check 3 to 5 days after having their period. Women who have menopause need to check once every month. All you need to do is take a look at your breasts and touch them. First of all, face to the mirror and lift up both of your hands. Check to see if both sides of your breasts are symmetrical. Put both of your hands on your waist and check if the color, size, and shape of the breasts are normal. Put your hands down, then check if there are any unusual lumps and see if the skin or nipple has any hollows or eczema, etc. The correct way for examination is to put 5 fingers together and wear the breast lump detection bag. Use your fingers, massage, and examine 1/4 of your upper outer breast, which is the armpit. Sit down and put your left hand on your right breast, then lift your right hand over your head. Follow these steps from top to bottom, from outside to inside. Massage, rotate, slide, and move forward. Examine clockwise carefully, including the center of the thorax, the bottom of the rib, and the armpit. Lie in bed and put a pillow under your right shoulder. Put your right hand under your head and put your left hand on your right breast. Again, follow these 4 steps from top to bottom, from outside to inside. Massage, rotate, slide, and move forward. Check clockwise carefully and examine the left breast as above. Use your thumb and index finger to press the nipple to see if there is any secretion. It is as simple as that. You can discover a problem immediately by using the breast lump detection bag as long as you have any clear, unusual tiny tumor. Then go to see a doctor to eliminate the dreadful cancer cell. The breast lump detection bag has received the 2000 International Invention Award in Germany. It is recognized worldwide by medical experts and was received by national presidents. Many well-known news anchors report about this product in feature stories. Some major television programs introduced this state-of-the-art product and invited doctors to demonstrate how to use it. Its results are recognized and recommended by gynecologists around the world, as well as anti-cancer organizations. Every woman who cares for her health must use the breast lump detection bag immediately.
BuyBeauty, make you pretty.